Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, today the topic which we have taken is accidental emergency. And so to discuss on this, we are being joined today by Dr. Pranab Baruah, Director and Senior Consultant, Accident and Emergency from Ayursundra Super Speciality Hospital. Well, just to tell our viewers that Ayursundra Super Speciality Hospital Accident and Emergency Department is the one and only NABH accredited accident and emergency department in the entire Northeast India. All right, viewers, so not to waste any more time, I'll straight away move to Dr. Pranab Baruah to talk more on the topic which we have taken today. All right, thank you so much, Doctor, for joining to Good Life, the health show today. So today the topic which we have taken is accidental emergency. Now, at first, if a common person will have to know or if they will have to understand what we are talking about accidental emergency, so how would you like to start up with?
Okay, thanks Pooja. Thanks for a wonderful introduction you made for our hospital. I am Dr. Pranab once again, and we are basically working in the emergency departments. So we deal with accidents and emergencies across all specialties, and accidents, as the name itself tells you, it is more related to trauma-like scenarios where patients and victims of road traffic accidents, or be it some homicidal or suicidal, anything, and everything will fall into trauma. So there's a vast scope of this subject here, and this subject is new, and we have very few numbers of specialists in Assam, and leaving apart the Northeast, because the other states of Northeast are lagging behind in this. So as a specialty, this accident and emergency started developing since the last decade, probably in the year 2009-10, and though it has been in India since the early 2000s.
Okay.
So in Assam, gradually we are picking up. We have quite a number of institutes where training has been done to train newer generations, newer doctors in accident and emergency, and even in the government medical college we have MD course in emergency medicine. So the future looks pretty bright as of now.
All right, so the future looks pretty bright. Doctor, we are talking about a very important department, that is accidental emergency department. Whenever any accident or any kind of emergency appears anywhere in the area, so first off, they report to the emergency department of any of the hospital we are talking about. Now, a very important department at this point in time, discussions are on. Now, if we talk about the challenges that is being meted out by this particular department, what kind of challenges do all the staff or all the members face whenever an emergency case comes up?
Okay, since I've already said this is a new emergency, so there are pretty much challenges that we have to face in terms of trained manpower, because we do not have trained manpower here, and in terms of equipments and all, because earlier it used to be manned by specialists of other specialities, like the surgeon used to be there to handle surgical emergencies, the medicine doctor used to be there to handle medical emergencies, and pediatricians used to handle pediatric emergencies. Now, this group of emergency doctors, they are trained to deal with all sorts of emergencies. So they are meant to know the emergency aspects of all the specialties, be it the heart, be it the kidneys, be it the gynecology or anything. So it is quite challenging, because we have got high expectations from the patients that turn up to us, and the patients are often anxious, and the relatives are anxious as well. They want quick results, because most of the time the patients are either seriously ill or they are having a serious health issue, or could be a victim of an accident.
All right. Now, doctor, if we talk about the commonly encountered emergencies, so what are the commonly encountered emergencies? We would like to know about that.
Okay. Our emergencies, we are trained to take care of trauma patients.
Okay.
And since we are located in the vicinity of the national highway, we do get a pretty high number of trauma cases. Trauma cases as in accidents that are occurring across the state. And we are a designated trauma center. And with backup of neurosurgeons, we have cardiothoracic surgeons, we have got neurologists, general surgeons, orthopedics. So commonly encountered ones are the victims of such accidents. And besides accidents, we do have a large number of cardiac patients coming in
Right.
after heart attacks, or neurological patients coming in with strokes. And again, the seasonal thing, like asthmatic attack, patients having difficulty in breathing. And in this COVID times, we faced a huge challenge because all the patients were routed through the emergency departments, and the patients with COVID, who required hospital admissions, they had to come to the emergency because they had complaints of breathing difficulty or chest pain, and otherwise that was the best department which could offer them some relief. So there are some certain issues like which are seasonal and sometimes related to pregnancy, some
Okay.
gynecological emergencies and all, which are also common, and allergies,
Right.
because some serious allergy patients comes to us. And besides some minor ailments, minor issues like a sprained ankle or some fractures here and there, and injuries following falls and all, those require stitching up of the wounds, and we can leave the patients. So these are the commonly faced situations here. Yeah.
Absolutely. So commonly faced situations, commonly faced emergencies that you get encountered like each and every day. Now, doctor, if we talk about how to deal with these kind of emergencies, now talking about from minor to major, like what is the first procedure you do? What is the first thing whenever a patient comes to the emergency department? What is the first thing do?
Yeah. Our emergencies are a little bit different from normal patients.
Right.
So we do not get much time to take detailed history taking of the patient. What we get to know is information from the relatives or friends accompanying the patients. We get a brief clinical history of the patient. And besides, we have to lay utmost priority on stabilizing the patient first. First, we prioritize our treatment because we do have a busy department out here, and we need to sort out the serious ones from the non-serious ones. Those patients that can wait from the patients that cannot wait. So those serious ones, we call it triage. We triage the patients according to the seriousness, and then we prioritize their treatment. And first is we try to stabilize them. Diagnosis is not important initially because we eventually want to settle the patient down, stabilize him, and then arrive at a conclusion and diagnose. So we make the work easier for the other doctors. We suppose a patient comes with a injury to his abdomen following an accident, and he'll come to us. We'll just prepare him, take history and all, get his investigations done, and after the investigations are done, we do get information that he has got an abdominal injury. Suppose he has got his liver injured, then he would need operation. Then we inform the surgeons. The surgeons, what they do, they get ready for the OT. They need not worry about the other aspects because they
All right. So basically, basic treatments are being given at this point in time, and when the basic treatments are being given, then they will be shifted to the respective departments or the respective specialists to take care of the particular patient, whoever comes for these emergency cases. Now, commonly encountered emergency, we already had an idea, but we will have more discussion with Dr. Pranab Baruah. But right now, we'll slip into a short break, viewers. Welcome back, viewers. You're still watching A Good Life, the health show with me, Pooja, and we are having a fruitful discussion with Dr. Pranab Baruah on the topic accidental emergency. Well, doctor, coming back to you again, before the break, we were talking about the commonly encountered emergencies, how to deal with them. So you were mentioning that basic treatment is being given, basic needs have been given, and then the patient is being shifted to the respective departments for the specialist to look after them, isn't it?
Yeah, you're partly right. It is the stabilization part that we lay our interest on, we stress on it.
Okay.
But most of the times we do give definitive treatment as well. We suppose a patient with a heart attack lands up at our hospital, then there is a saying called time is muscle. That is the sooner the medicines are administered to him, that the chances of him recovering increases. So in such situations, like for example, a case of heart attack or a stroke, we do sometimes need to administer some blood thinners or some clot busters, what they call, to break the blood clot.
Okay.
And that has to be done within a specified time frame. So if the patient turns up at night when the primary consultant is not there, or consultant cardiologist is not in the hospital, this aspect has been taken care of by the emergency department. So the relieving the patient of the obstruction in his heart is the work of the emergency doctor out there in the hospital. So the definitive treatment most of the time is later given by the specialist in the hospital once the patient is admitted.
All right. Yeah. Now, doctor, I could imagine the quickness and the emergency when any of the patient comes to the emergency department, and how quick like everybody has to be, because the first thing first is to treat the patient, to give the basic amenities at that point in time, isn't it?
Yeah, you're right, because we have to look into all the issues like arranging blood for a bad patient, to arranging the operation theaters,
Correct.
arranging the anesthetist on call, so as to make the patient ready for an operation, and besides providing him treatment of his primary conditions. So it is challenging, but it is very interesting. That's why there is a saying called the emergency is the best initial 15 minutes of across all specialties.
Okay. All right. So, okay, wonderful words out there. Now, doctor, if we would like to know about the scenario of emergency medicines in India and Northeast, could you please put some light on that as well? Yeah.
Emergency medicine is coming up in India.
Okay.
So the initial work was done by doctors in South India, mainly Tamil Nadu and Karnataka, and gradually this thing spread to North India in Delhi, and later on in Kolkata in 2011. So in Assam it is pretty much late, and it started in the year 2015. So we were the ones who were trained in emergency medicine, and not in Assam, we were trained outside. Okay. I did part of my training in the UK, and then later on I came back and I was working in Kolkata. So it is good to see that the situation is improving in Assam, since the government took the initiative of starting recognizing emergency medicine as a separate, distinct specialty, and starting emergency medicine courses in the medical colleges. So that has made the people aware that this is a wonderful branch, and the students are also keen to take up and accept this specialty as their area of expertise.
Okay.
So I am hopeful, because eventually all the hospitals, they need an emergency department. They need the emergency department to be manned by trained manpower, because unless it is manned by trained manpower, it won't serve the purpose, because emergencies, as you know, is always comes at a time when you least expect it.
Absolutely.
So it is not predictable. So it might happen at 2 o'clock at night, or it might happen at 11 o'clock when the doctor might not be there. So emergency is developing, and Assam, we have got a few places here where courses are run, not by the some private associations, and even in medical colleges, the students, they around 6 to 7 students, they complete their post-graduation and are coming out. And these are the doctors who are spreading the word that spreading the information that this department is worth working and is a wonderful career prospect.
Absolutely. Now, doctor, in that scenario, when emergencies can come up anytime, as you mentioned earlier, that it can come up at 2 a.m. or it can come up earlier also. Now, at that point in time, it's very difficult for a doctor or as members like other members, staff members, to consult the attendants, because at that point in time, they are already nervous. They have a lot of confusions in their mind. So at that point in time, what kind of consultations do you provide to the attendants later when a basic has been given to the patient?
Oh yes, this is a wonderful question from you, and it is a part of our training. It is a part of the training of the emergency medicine course that lays stress on communication. Communications like it might be breaking bad news to the patients, or it might be general counseling of the patient.
Absolutely.
So you have to be very compassionate. You have to talk with empathy, and you have to be knowledgeable as well. You have to know the details of the patient, and it is not something mechanical, which unlike other departments, you cannot be mechanical because you are dealing with emotions here. You are dealing with anger. You are dealing with anxiousness. So it takes time, and over time you can master this art. So basically what you need to do is like just comfort the patient, take care of the patient. The relatives, they will understand because they will see you trying hard to salvage their patients. And eventually after everything is done, you come back to the attendants, come back to the relatives, let them know what is happening.
Okay.
And no guesses here, no guesses work here. You just need to tell them whatever is happening and what are the chances. And we do not talk in terms of percentage, because that is what some people, some relatives, they ask of us, like what are the chances of him surviving, what percent chance is there.
If
we
it
do
is
not
a serious
talk in
case.
terms of percentage, because this is not mathematics. Yeah, it is a serious case. If it is a serious case, we cannot tell them in percentage.
Absolutely.
But if we are hopeful, we let them know that we over last 6 years, we have seen so many patients, and out of which this many came out. So everything is dependent on facts, because our department runs on evidence-based only, on the basis of evidence, because these evidences are obtained from all the areas across the world where research take place. We follow the Royal College of Emergency Medicine, we follow the American College of Emergency Medicine.
Okay.
We follow all the guidelines from across the globe.
All right.
That makes our work easier.
Absolutely. Now, doctor, a very important question that surfaces in my mind, and of course the patient's attendants as well. Now, if any emergency case comes up, do any formalities is being taken up by the hospital? What kind of formalities will the attendant have to do at that point in time? Because it's an emergency case. Everybody would like to know that a treatment should start as early as possible. So apart from that, formality part or the paperwork, what do you have to say on that?
Yeah, that is again subjective. We are bound by the Hippocratic Oath to serve our patients. We have to, legally we are bound to work for the patients. It is not the formalities that we wait for completion of the formalities. It is just the life of the patient first.
All right.
Any other formalities can wait. So that is what we explain. We work in a group. It is not a single man working. We work in a group, and we take care of the patient. Even if it takes 1 or 2 hours to stabilize him, we will not come and formally ask them to complete the formalities. We will wait, and till the patient is stable, we do not ask the attendants to do anything. The only thing is that there are certain formalities for which you need consent of the patient's relatives. Suppose I need to do a procedure which is which if I do not do it, it would be life-threatening. So I would need to have a consent from their guardian.
Absolutely.
So only those formalities are done in real time, because we need to explain it to them and then get a formal consent. It is nothing to do with financial or monetary thing, because no doctor should, and I'm sure all the doctors follow whatever we practice here.
Absolutely. Now, doctor, any instances or any example you would like to share with us? Any instances that had happened and it would it was a challenging job for you guys. So you would like to share with us at this point in time?
Yeah, there are so many because every day is full of instances, and our kids love to hear stories from
Right.
us once we reach home. So two similar instances. A lady, she was washing clothes besides a pond here, and her son was playing nearby. A son who was a toddler, around 3.5 year old. So the lady, she did not notice her son, and the son was missing. Accidentally, he fell into the pond, and he was inside the water for quite some time. So you can understand that later on when the child was discovered to be missing.
Okay.
So all the people from the locality, they tried to pick up the child up and they rushed to our hospital. Since it was a child, we did not want to leave our efforts. We continued the efforts, although clinically the child was, he did not have a pumping heart. We call it a cardiac arrest. He was in cardiac arrest.
Okay.
And later on we did CPR. CPR is cardiopulmonary resuscitation. We did CPR for 45 minutes because it is not easy to do CPR for 45 minutes. But we had been doing it for 45 minutes, and later on we saw some signs of improvement, and gradually he was put on a ventilator. He recovered, and on day 14th, he comes walking to us, and with a smile, he expresses his gratefulness to us. He says, "Thank you, uncle.
Okay.
Thank you. It is only for you that I am here today."
All
so
right.
these instances are very fulfilling for us.
Absolutely, absolutely. And that gives you more challenges to face more challenges in near future, isn't it, Doctor? Doctor, we are really short of time. So what would you like to tell our viewers who are watching our show at this point in time?
Yeah, I would like to tell them that emergencies are always busy. We would like to see only emergency patients in the emergency. It is not like a common flu should not be in the emergency, because the space should be kept for the serious patients. Although at night, when the other doctors are not there, such patients come to the emergencies.
Okay.
And I want to make the people aware that some complaints like a chest pain should not be taken lightly, because it could be potentially a heart attack. Some symptoms like slurring of speech or weakness of one side of the body or sudden fainting attack could be some symptoms of some more serious conditions.
Okay.
And those should be brought to the hospital, to the emergency as soon as possible, so that early treatment can take place, because in most of the medical conditions, time is very essential.
Right.
And certain training on basic life support is very important, because basic life support is given by, can be given by bystanders, can be given at home, and basic life support does help in saving patients, because a patient with cardiac arrest whose heart is not pumping, those patients can still be salvaged if basic life support is initiated in time.
All right, so
And,
basic support on time is
my advice
very,
to the
very
doctors
important.
out there,
Yes, basic support on time is very, very important, Doctor.
Yeah,
We
you're
have
right.
to wrap up this show at this point in time. Thank you so much for sharing those wonderful words. And I'm sure the viewers who have watched our show must be benefited with the answers Doctor gave and the discussion we gave. Thank you so much, Dr. Pranab Baruah, for joining to Good Life, the health show at this point in time. And viewers, with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.